Welcome back to another episode of Research Works podcast. It's Dana here. It is such a pleasure to have you join us for another episode. I realise it's the changing seasons right now for us here in Australia, certainly in my end of Australia in Perth. It is the transition to colder weather. I'm not coping with that too well. The dark skies in the morning, sunrise is much later. I'm not sure how I feel about that. But then everyone else is enjoying spring on its way. So wherever you are in the world, I hope you are enjoying whatever transition in season. And in true form, I like to be able to link things through with regards to what we're talking about. And we are talking about the transition process from childhood to adulthood today on the podcast. And to talk us through this, I have someone that I have admired from afar, read her work so much, and has inspired so much of my work. So I can't wait to speak with her. Welcome all the way from Ireland, Dr. Jennifer Ryan. Hello and welcome.
Hi, thanks for having me.
It is such a pleasure to have you join us here today. Like, full disclosure, our goal was to have you at Oceania in Hobart, and that didn't quite go to plan, did it, Jen?
No, I was so disappointed. I was all ready to leave, and about a day beforehand, I wasn't able to go. My flight was cancelled. So it was such a pity I couldn't be there.
Yeah, we really missed you, and we're just so grateful that you were able to, through the power of Zoom, still be able to talk to us at the Congress. I was sitting there taking notes and just loving everything that you were saying, and it was such a highlight for so many of the clinicians that I know and work with. So we are going to be talking about that very topic, and I've got so many questions for you, so get ready. But the title of your keynote was From Childhood to Adulthood, Lifespan Insights into Health and Health Service Needs in Cerebral Palsy. It's a short title. So many of our titles for everything that we do are really long, but in those few words is everything that's so impactful and so meaningful. So before I get into lots of questions for you, Jen, let me give everyone a bit of a formal introduction about who you are. So Dr. Jennifer Ryan is Director of Cerebral Palsy Lifespan Health and Wellbeing, or CP Life Research Centre, and an Associate Professor in the School of Physiotherapy at the Royal College of Surgeons in Ireland. Jennifer conducts research about cerebral palsy under the themes of health services research, population health, and physical activity and exercise. With over 100 journal articles published on these topics, Jennifer strongly believes in consumer involvement, and her research topics and approaches are shaped by the views of children and adults with cerebral palsy. Her work also focuses on knowledge translation, with active translation of her research findings into practical applications. Love everything about that. We also love to do, and I've given a bit of a warning, that we do an informal getting to know you. And everyone gets really nervous about this. And so I try to put myself in the position as well when I try to pick an icebreaker that I haven't thought about at all. So even I feel nervous about this because I don't know my answer just yet. So here's the question, Jen. Here we go. What is something that you discovered about yourself in the last 12 months? It's very specific. Came from the office here at Healthy Strides. Do you have anything there to add?
It's very early in the morning here, and I haven't had a coffee yet, so I feel under pressure. But I suppose just recently, unfortunately, I didn't make it, obviously, to Australia, but I had to travel to London and to Birmingham in the UK as well. Just a couple of months ago, and it made me realise how much I love travelling on my own. At the moment, life is very busy. There's always a child asking me for something, or someone in work asking me for something. So having a bit of time walking through an airport and not having to answer to anybody, I realise I really enjoy that.
That is a really good answer. That's a really good answer. I love that. And how just the silence is just your own thoughts, I imagine. Yeah.
Yeah. Well, actually, unfortunately, my AirPods broke recently, so it has to be my own thoughts because I can't listen to any podcast at the moment.
That is a bit of a tragedy. Make sure you get that rectified ASAP.
I need to get that fixed. Yeah.
Good answer. I really like that one. Ed, do you have an answer to this one? What have you learned about yourself in the last 12 months?
Look, I think I've discovered that, because I'm a software guy, I've discovered that I don't think I could ever go back to life without AI.
Wow.
So
already.
Yeah, look, AI has been my best friend, but I use that term very loosely because
Some people marry their AI, so you do need to be very clear about that.
Well, so here's the thing. Obviously, I use AI every day as part of my software development. But I've also discovered about myself that I am a very hard taskmaster. And so I put these AIs through the ringer, and I think when it comes time for our robotic overlords to take over, I think I might be in a bit of trouble. So I need to treat them nicer in the future.
Oh, we all have this sneaking feeling that AI is going to completely take over our lives one day, don't we? Like we all kind of know that. And the Terminator foretold that in several decades ago. So
yeah, so
you're in trouble.
I'll work on my yeah. Anyway, so that's me. How about yourself?
Well, it's quite funny, Jen, what you said about yourself in terms of the quiet and doing things on your own. I have realized that about myself. Like I think I made a discovery probably about 2 years ago that I always thought I was an introvert, but then I realized actually I do get a lot of energy being around people. So I'm this extrovert, and I was in a bit of denial that I was, like I always thought I was this quiet person, but actually when I love the topic and the people that I'm around, I'm definitely, a bigger personality. But in the last 12 months, I've realized that after I have those moments, on the weekends, I'm much more boring. I love silence and quiet. Like I'll take myself to my room, or I'll go to a cafe somewhere. Sometimes I don't even want noise, and I just sit there and I might read or just do my own thing, and I love it so much. And I don't know what happened there, but I think I'm more of an introvert again. I don't know. Something's happened.
I think you could be an extroverted introvert. Can't you? They can be both.
I think I've heard that, and I think I might have that. So yeah, I've been going through this bit of discovery, and I realize what I really need to energize, and it's absolute silence. Like I like it. I like the quiet. So the long haul flights, I'm about to head to EACD. I will sit there and I go, this is great. Maybe until the 6th hour.
It's lovely not having Wi-Fi for about 2 hours, isn't it? And then you start to get...
I agree.
You start to miss it.
I agree. You do. You start to miss the technology side of things. I always thought I could do it for longer, but our lives are now just so connected. And
that's an IT guy's worst nightmare.
Yeah, no Wi-Fi for more than 2 hours. Well, let's get into the topic that we have here today. I want to have as much time with you as possible, Jen. Before we get into the ins and outs of what you spoke about at the keynote, I thought it'd be really great to hear more about the work you do at CP Life and what your role is there. Do you mind talking us through that first?
Yeah, I'd love to, because I'm very proud of my team there. I work with a brilliant team. So, we established the centre in 2023 to really just bring together researchers who are doing research in CP across RCSI. And a couple of our members are from different universities who we always work closely with as well. So we're a research centre. What I'm proud of is that we really are dedicated to generating evidence that improves services and supports for people with CP. So the focus is on CP.
Yeah.
And we do that by partnering with lots of people. So people with CP, families, health professionals. We couldn't do any of our work without those partnerships.
Sure.
To do the research and then to translate it into practice. So as well as doing the research, we spend quite a bit of time trying to get that research out there into something that's helpful for people with CP and families.
Fantastic.
So we've grown over the past few years to about 20 people now, and most of them are postdoctoral researchers, and they're all working on a specific project related to CP, or some are working on projects related to physical disability a bit more broadly.
Oh, fantastic. How beautiful is that to have? It's really the entire, flow of research, isn't it? From ideas that come from people with lived experience, but you're always thinking about how this translates beyond mere research, which has been such a focus lately, hasn't it? But your team's already there, ready, set up to do it.
Oh, completely. And that's what's so lovely about the team is that everybody has the same mission and values, and they all just work so hard to do research that improves the lives of people with CP. So apart from doing the research together, just the chats we have in the office, and we all have share similar views, and it's just lovely to work with such a great team.
Oh, that is absolutely fantastic. Thank you so much for telling us about that. And I can so see how all the work and what you presented at the keynote now fits in with all of that, really, across the lifespan. So really starting broadly now with regards to the health needs, when we're talking about cerebral palsy, what do we know about life expectancy? Like, what should we be really aware of here?
Yeah, there's been some really helpful papers on this topic, and one from Australia a few years ago. But a lot of the work has been done by the Life Expectancy Project, and they're based in California. And just a couple of months ago, they updated their data. So they published a new paper describing survival in people with CP. So before that, they had a paper in 2014, which I rely on all the time. I always go to as my go-to reference. So I was so excited to see this update. But I suppose that the headline is that the vast majority of 4-year-olds with CP will live until they're at least 30. And of course, that varies depending on functional ability. If you take a 4-year-old who maybe doesn't lift their head and prone and is tube fed, they have about a 28% chance of living until they're 30. But for a child of 4 who walks unaided and self-feeds, they have about a 95% chance of living until age 30.
Right.
And then when you look at young adults with CP, most of them or many of them have a life expectancy that is very similar to the general population. And when I share these findings, I think, it's always very stark talking about life expectancy, but I only share them because I think it's just so important to remind people that CP, as we know, is not just a childhood disability. So can we keep thinking about that 4-year-old child, what their life will be like when they're 30 or 40?
And what's the significance of looking at 4 years of age and 30 years of age that you said there? What does that relate to?
Yeah. Well, I suppose what these studies took 4 years as a starting point, but they did go by every decade of life.
I see. Yeah.
So they do report survival at 20, 30, 40, 50 years. I just pick 30 as a kind of mid or to early point in adulthood to see what it's like then.
And it's such a good idea, isn't it? You're so right about that. I remember a conversation I had with Mark Peterson a few years ago, and he was talking to some doctors in GPs, and he was shocked by some of the conversations he was having because people were saying, do children, do adults have CP? And he was shocked by that. And I thought that was, really, how could that be? And I suppose that's the value and importance of talking about life expectancy and the terminology that I've been seeing a lot lately. And it's so important, it's more about childhood-onset disability. And I've seen that changed at EACD in Oceania, talking about childhood-onset disability. What's the significance of that terminology, Jen?
Yeah, and I think it relates to that point you made about GPs. I suppose a bit in Europe, I say European Academy of Childhood-onset Disability quite a bit, and it's taken me a while to come to terms with saying childhood-onset disability. It's a bit of a mouthful. Yeah. But now it's actually pretty easy. It comes naturally to me. And I actually think it's great to force people to say it. If anybody says childhood disability now, I always correct them. And it's mainly to make people stop and think about how they frame CP and other childhood onset disabilities. Just by changing that name, can we raise awareness that CP isn't a childhood disability? And can we start thinking, getting people to think about how services and supports are designed for the whole lifespan? And even by having an organisation like that use that terminology, I think it can raise awareness in people who don't know very much about CP, but who have that influence and power about funding services supports or writing health policy. That we get them to reframe how they think about a CP.
Yeah, it's really interesting, isn't it? It's a slight reframe, but a significant one at that. Because I think about, how I might communicate, and I need to make sure that I'm consistent with that too. So every interaction you're having with someone, you're hopefully leaving an impression to think longer term than just right now.
Yeah, exactly. Yeah. And even amongst people who know a lot about CP and maybe work with children with CP, having to get your tongue around a childhood onset disability maybe makes them pause and think when they're seeing children every day, actually about the long-term picture, just, reframing that.
Yeah, absolutely. And, I think it's the whole point of why we're doing what we're doing right now. We don't want kids to be good at doing therapy. What are we actually doing here? We're trying to think about setting them up for their life. That's the whole point, actually, isn't it?
Yeah, exactly. Yeah. I'm so glad you said that. That's what I think about it all the time. Yeah.
It's really, really powerful reframe. In terms of the reason why we need to sort of look ahead, there's many things, and we're going to get into all of it in terms of services, but also from a health perspective. I remember reading your papers, and just to, my gush point here, and it's embarrassing for you, I'm sure, because whenever someone does, like, I just love your work and I love your papers, but genuinely so. So the articles that you had published titled Non-Communicable Disease Among Adults with Cerebral Palsy and Mortality Due to Cardiovascular Disease, Respiratory Disease, and Cancer in Adults with Cerebral Palsy. They were such strong titles because I'd never seen anything like that before. So many of the papers that I probably read over 10 years ago, again, had that real focus on cerebral palsy right there and then, and you were really drawing us to look at lifelong by looking at cardiovascular disease. As someone who has so much knowledge in the area, please, do you mind just walking us through about what we currently know about cardiovascular disease in adults with cerebral palsy?
Yeah. And I suppose just to start with, my PhD, the topic was cardiovascular risk factors amongst children and adults with CP. And when I started that, I met lots of people that said, why are you looking at this? Cardiovascular disease isn't a problem. And I went to the AACPDM annual meeting in, I think, my second or third year of my PhD. It was the first big CP conference I'd gone to. And Ed Herdfitz was doing a keynote, and he referred to cardiovascular disease, and he mentioned some of Mark Peterson's early work. And and a doctor in the audience stood up afterwards saying, well, this isn't really a problem. Our adult CP patients die of respiratory disease. They don't die of cardiovascular disease. And I'm sure that is his experience in the clinic, but it's maybe not representative of the whole population. And as you can imagine, as a PhD student whose whole top research, also PhD, was on cardiovascular disease, I was very deflated. I thought, what am I doing? Why am I doing this? So I suppose since then we have been able to gather some evidence, and a lot of it is to change that mindset around actually the long-term health of adults with CP. So we know that adults with CP are about 3 times more likely to die from cardiovascular disease than the general population.
Wow.
And they have an increased risk of a range of different types of cardiovascular diseases like heart failure, hypertension, ischemic heart disease, and actually about 6 times higher risk of cerebrovascular disease. And when we did look at mortality, we did find that the relative risk of respiratory disease, of dying from respiratory disease, is actually higher. But that's because not many young and middle-aged adults without CP die of respiratory disease. So when you're comparing adults with CP to adults without CP, obviously more adults with CP die of respiratory disease. But when you look at the absolute numbers, and there's some caveats around this that I won't go into, but when you look at the absolute numbers, most people with CP will die of cardiovascular disease, not of respiratory disease. And so I think it's just important to think from a public health perspective.
Yes.
How are we looking after adults with CP?
Yes, that is so interesting. And why? Why do we think there's such a huge risk here for adults with cerebral palsy?
Yeah. I mean, I'm sure there's lots of mechanisms that I haven't even thought of. There's been mechanisms that people have suggested that I don't understand. I mean, the obvious one is lack of access to physical activity throughout life. So we know people with CP are less physically active at all ages than the general population, and the environment isn't built for people with CP to be active. So I suppose that's one major risk factor for cardiovascular disease that we know exists in this group.
Sure. Those numbers are incredibly high, and you're right, from a public health perspective, this must cost governments a lot of money from a hospital perspective. I'm sure you've looked at that too, I suppose.
No. There was a time in one study that we said we'd look at the cost of cardiovascular disease, and we ended up not actually getting around to being able to do it. So that is something that should be done.
Yeah.
Yes.
Because you can only imagine what that would look like. And from the perspective of, physical activity, look, it sounds like such a simple thing to implement, right? But it really isn't that easy when you think about the environmental barriers that are in place, having equipment, I guess in my mind, I'm thinking, children, young adults, GMS level 3, 4, 5 that require equipment. There's a lot required to get someone to get their heart rate up, to get them up and moving. It takes a lot more. Those stats, is that for cerebral palsy, I gather it probably can't be that granular to go GMFCS levels. Is that possible to do, or is it just absolute CP?
Yeah, at the moment, most of the data we have is on the whole group, the total population. And some of that is just the type of data that we have access to.
Sure, of course,
There's such a balance between getting good information about people with CP versus getting large samples of people with CP. Like for my PhD, I recruited people from GP practices across the country and from one clinic that they existed for adults with CP, and managed to get about 60 adults with CP from the whole country. So while we had granular information about, GMFCS level and demographics and different types of impairments, we didn't have enough data to make any good conclusions about absolute, relative risk or prevalence of cardiovascular disease. Whereas when we've looked at that in large populations, we've managed to use things like GP databases, or in the US, they use insurance databases, but it means that you don't have that useful information. So I suppose at the moment, for some chronic conditions, it does look like maybe GMFCS levels 3, 4 and 5 are more likely to develop them than people in GMFCS levels 1 and 2, but there just isn't great evidence on that.
Yeah. And that just speaks to how this is such an emerging area, really. Like in the fact that you started looking at this just over 10 years ago just shows, like how far you've brought it already, but so much work needs to be done in this space to understand it, doesn't it?
Absolutely, yeah. And data is always going to be a barrier to that. I think we need to maybe work together internationally to see what data sources we can pool to look at this. Absolutely.
Now, we've talked a little bit about, obviously, cardiovascular disease. I noticed that in your keynote, you spoke a little bit about chronic diseases as well in adults with CP. First of all, like, what is it about chronic diseases? Like, what constitutes a chronic condition, I suppose?
Yeah, so when we did that systematic review, that was the first thing that we tried to define. So, yeah, it's because we use the term all the time, and then I thought, okay, well, what actually are we going to conclude in this review?
Yeah.
So, I mean, sometimes it's used interchangeably with non-communicable diseases, but the definition we went with is a condition that generally lasts a year or longer and has an impact on a person's life. And it can be a physical or a mental health condition. So cardiovascular disease, cancer, depression, those kind of big conditions.
Sure. So we've spoken about cardiovascular. Are there any other major chronic diseases that relate to adults with CP that come to mind in some of the work that you've done?
Yeah, well, we found we found data on a lot. There were still huge gaps. So we identified a list of over 60 chronic conditions that we wanted to search for in the literature.
Right.
And we did find data for over half of those, but for a lot of it was one study for each condition. So I suppose the main things that what I took from the review anyway, one is I like to think of it as a go-to resource that if someone asks about a condition in adults with CP, we can say, well, this is the current, one source of fruit. This is where we are, what's the prevalence of chronic kidney disease. We can look it up in that and it can tell you straight away what it is.
Sure.
But what struck me was just the range of physical and mental health conditions that adults with CP are more likely to experience than adults without CP. So they're more likely to have, musculoskeletal conditions like arthritis and osteoporosis, mental health conditions like asthma and depression, and then, chronic kidney disease, liver disease, both obesity and malnutrition. So there's a whole spectrum of chronic conditions.
Wow. And what do you take from all of that? I guess there's this whole list of that, you can see how a lot of them could possibly link to physical activity. I'm sure that's sort of part of it. But what do you take from that list when there's just such a huge list when it comes to cardiovascular and chronic that affect mental health and musculoskeletal?
Yeah, I think the main, maybe I should tell you the reason we did this review was, and I've told this story a couple of times, so hopefully it's new to your listeners, but I work closely with Emma Livingston, who's the CEO of the UP Adult CP movement in the UK.
Yes.
And she gets a lot of questions from adults with CP about what health conditions they might experience. And also she needs to go to the NHS to advocate for health services. So she's always looking for data. And as you said, governments are interested in chronic conditions. So often that's a useful angle to take when you're talking about people with CP. And so we wanted to do this review to have one document. This is what we currently know about all of this range of conditions, rather than having to go to every single study, which is obviously gets very difficult even when you work in research full time. So I think what the results mean to me, or what I want to take from them, is just that we need to raise awareness and to provide proactive healthcare to adults with CP. It just shows that clearly CP doesn't stop changing when you reach, 18, and people with CP require knowledgeable health professionals to support them throughout life. And many of these chronic conditions, it's not to scare people, because many of them can be managed, but they can't be managed if doctors don't think to look for them or aren't proactive maybe in screening for conditions and managing them early. And there's lots of good examples of, in general guidelines, if you take a general guideline about cardiovascular disease, they might have a section saying, look out particularly for this population where there's an increased risk. And they mention if there's something like chronic kidney disease, look out for people with chronic kidney disease, because we know there's an elevated risk of cardiovascular disease. They never mention CP as a group to look out, for this increased risk. So I think we should be all working towards getting CP mentioned in general guidelines for cardiovascular disease or musculoskeletal conditions or mental health, to say these are the guidelines for the whole population, but here's a subgroup who we need to specifically, provide support to.
That is fantastic. You can see such value in that. And, you touched on it there as well, and I'll pick up on that. If parents of children with CP right now are hearing about this list of potential long-term chronic health conditions, looking too far in the future sometimes can be quite daunting, but what would your advice be there for parents right now if they hear about this list? Is there something practical that they can do to manage this information?
Yeah, I think I often meet people who are really keen to get information and want to know all of it, and other people who just don't want to hear it because it's too overwhelming, and they, obviously you don't want to think about your health and long-term, health. So I think for families, it can be particularly important to be aware of that information, so that when their child at whatever age wants to start learning about their CP and maybe what living as an adult with CP looks like, that they're able to direct them to this information and provide it as needed. I often think it's too much to share all at once, but organisations like the UP movement use this information on their website during webinars, during peer community groups sessions to support people. So you're providing that kind of peer support network alongside the statistics. And if you provide it in that way, a lot of adults, I think, would say that knowledge is power, and that if they know that they might have an increased risk of cardiovascular disease, they'll become more aware of asking their GP for, can you check my cholesterol? Looking for accessible gyms or trying to find ways to be active. And I think a great example, just recently we did an exercise and education program, a research project for adults with CP, and the education program, one of the topics was bone health. And as a result of the program, one of the women went to her GP and said, I have an increased risk of osteoporosis. Do you mind, give me a DEXA scan?
Wow.
And her GP said, of course, like, why hasn't anybody done this sooner? And it was, but the GP would never have thought of, suggesting it to her. It was her having that knowledge to empower her to go to her GP and ask for it.
That's so fantastic. And I love that, in terms of linking that into, health services now, like when you start thinking about what that means, you are just constantly preparing our young people to be able to advocate for themselves. And you're right, knowledge is power. Like otherwise you present, you might present to a doctor, and where do you even begin? And if they don't even understand cerebral palsy, that might be where they start. But there's actually so much from their health that they need to be able to look at. We had an instance here with a young person that we know here that had to go into hospital, but she's sort of in the transition into adulthood at the moment, so had to go to an adult hospital because it was ED. And their experience when they were describing it was so challenging to hear because they couldn't understand that what cerebral palsy meant for her. She normally does hydrotherapy, and they were kind of like, oh, so she goes swimming? Like yes, but there's a person that goes in with her, and they couldn't understand how that worked. And then transfers were then very difficult, and just relaying that information, the family came back and went, right, we need to find a way that we can actually tell people about her condition and what she is right now so they can actually start treating why we went in there, because all they could see was the CP part first.
CP.
Yeah.
Completely.
So really challenging. Yeah. Can we talk a little bit about with regards to pain and mobility decline? Like it's something that often comes up, I suppose, as whether that is classified under chronic, I'm not sure. But, when we talk about mobility decline, that's important to note that because we've all been taught about, cerebral palsy. The original definition is it's non-progressive. But what we mean by that is neurologically, like in the brain, that's non-progressive. But we know that there's this decline that does happen over time. What data do we have on that at the moment? Do we have anything that we can refer to?
Yeah, there's some a great systematic review on it that shows about 56% of adults with CP experience decline in mobility over time. We've done individual studies where it's been much higher than that in surveys. And you can imagine that's across GMFCS levels. So it's not just mobility, it's decline in ability to transfer, ability to sit, to stand. And as I said, I often talk about, I do talk a lot about chronic conditions in adults with CP, but almost as a mechanism to advocate for better health services.
Yeah.
For what people with CP, I think themselves would say priorities are often pain, mobility decline, falls. We have done some research that shows that adults with CP are 4 times more likely to fall, and they experience 6 times more falls than adults without CP. And those were just falls that they went to their GP for. So they must have been bad enough that they visited a GP about it.
Wow.
I'm sure they fall all the time at home and don't go to see the GP.
Yes.
And just the psychological impact of this, you definitely, there's research on anecdotally that adults with CP limit their lives because, of that fear of falling and not sure if, about a certain environment, if they go somewhere new, that they'd rather just stay at home rather than fall.
Wow. And then you think about then the recommendation we might often make is, be more physically active, get out there and get involved. But then the fear of falling is a big one, isn't it?
Completely. And I really think just that program that I mentioned, the exercise and education program, it was very basic strengthening exercises, but the impact it had on falls, which we'd never planned. We didn't design it to be a falls intervention, but that was something that came up a lot, that it did decrease falls and people felt more confident to participate in different areas of life. But Amazing. It was such a simple intervention. You just think all adults with CP should have access to an exercise program that's designed by a physiotherapist.
Yeah. Can you tell us a bit more about that exercise program? What did that actually look like in terms of dosage and time commitment perspective?
I have to acknowledge that it's my colleague Manjula who's working on this at the moment. She has a fellowship to lead it. So she will be presenting it at EACD if anybody's interested in going to view it. But it's an 8-week online program. Actually, we chose to do it online because of all those barriers we know to accessing gyms and accessing physio.
Yes.
And it was designed by a group of expert physios and personal trainers who have both clinical and lived experience knowledge of CP.
Yeah.
So they designed this 8-week program, 1 hour a week over 8 weeks, a range of upper and lower limb strengthening exercises using the standard strengthening guidelines.
Wow.
And then about 20 minutes, and that was education, which actually I think was what was really powerful for a lot of people.
Yeah.
I always think this information's on the internet, you can look it up, but actually lots of people hadn't heard it before. And so in having a direct education program was really valuable to some people.
Oh, amazing. All right, we'll look out for that for sure at EACD. Now let's go into the other part about your keynote, which I found incredibly interesting. Certainly, it's amazing to start seeing all the work that's been happening now about health service needs. So to start off with, what are some of the most common challenges that you hear about when young people need to transition from pediatric services to adult services?
I mean, there's just so many. I should say this is obviously context specific. I'm always wary of that when I talk about it, because we've only done this research in Ireland.
Sure.
I know there's similar experiences in the UK, and you hear similar across the world, but it's very much health system dependent.
Of
I suppose
course.
what we found was, one, just a lack of any information for young people and parents, either about the process, about what was available in the adult healthcare system for them, even just a lack of information about their CP and how they might manage their physical and mental health in adulthood.
Yeah.
We had a lovely quote from one of the participants in a study who said, I just don't know where I'm going or what I'm doing or how I'm going to do it. And it really highlighted how young people can feel really lost in the system.
Yes.
And because they don't get information, then they can't engage in a transition process because it's kind of sprung upon them. Often, if there is information, it comes last minute, and then they're asked, "Do you have any questions?" And they've had no chance to think of any questions. And then they're discharged and they don't know where to go.
Wow.
I suppose some other fundamental problems are the lack of an adult clinic or an adult clinician who has expertise in CP. So there's no place to directly transfer young people to.
Sure.
And then in the absence of that, GPs often take over coordinating care, but GPs often aren't involved in the whole transition process. So they don't really know what to do, and they don't get that information or get to know the young person until they see them as an adult.
Wow.
And then ideally there should be a period of joint working between children and adult health services, that if there is a professional or a team in adult services, whether it's a physio or an OT or a multidisciplinary team, that they spend some time working with the child's team together so that they can share information and get to know the child and the family, so that it's a smoother transition.
Yeah. Look, everything you're saying resonates, certainly from the things that I've been hearing about. You hear so often, and you do see it, there's only a few pediatric hospitals often in each city. And so in terms of coordinated care and having everyone on the same page in the same building even happens. And then when they go to adults, there's more hospitals that tend to be more geographically related. So then they are in different places and not all of their services now come under one. So it's just a bit, the challenges from that was beyond their control, I suppose. But you've got this great support, and then suddenly it does feel geographically even, it's a massive, massive shift.
Yeah. And I suppose young people or young adults have been thrown into that system where it's really difficult to navigate for anybody.
Yeah.
But without being given the skills to, manage their own health, to understand what different health professionals do, to be able to communicate with health professionals and self-advocate as well. A lot of young people we've spoken to talk about how they don't want to be an advocate, but they've had to be an advocate for themselves, and they've had to just learn that because no one's helped them with that process. So I think that could be improved from an earlier age about how do we support young people.
Sure. I mean, that transition is hard anyway, right? From those years to becoming an adult, yet with the data you just spoke about with regards to chronic conditions and cerebral palsy, there is a significant health component here that also needs to be transitioned, and adequate support that doesn't just stop. So they sort of have it on multiple fronts, don't they? And I can see why before you're saying that if you can equip people with knowledge, that's one part of it right there and then, just to actually be able to talk about what they need. So barriers is something that I think we can really understand and see, and parents do talk about it, and the young people obviously are thinking about it. What can be done, I suppose, being really solutions focused? There's things that are harder to change, things are within more control, and we want to be able to pick those ones first, low-hanging fruit. What can we address? What would your thoughts or recommendations be, and what have you learned so far?
Yeah, I think this a whole transition process that I could maybe cover separately, but one thing that really stands out, and even it came up yesterday in talking to a group of young people, was they want to learn from other people with CP. So
Sure.
they, have been in a healthcare environment where their parents are helping to make decisions and health professionals are helping to make decisions. And often neither of those people have CP. So they aren't coming from a perspective of what it's actually like to grow up with CP and to navigate adulthood with CP.
Sure.
And so often I think the most valuable thing is just connecting younger people with people who are slightly ahead of them in the process to say, yes, there might be difficulties, but here's some advice or here's some solutions. We developed some videos just for that reason, because we find it difficult in Ireland, even where we're a tiny country, to bring people with CP together in person. It could be hard to bring to create peer networks. So we created some videos of a teenager talking to a young adult with CP about that experience of navigating the adult health system and just generally becoming an adult with CP,
Right.
so that other teenagers can look at it and learn from them. And I think that can be valuable, just listening to other people with CP.
Yeah. Is that available for people to listen to outside of Ireland? Is it something that's specific to a research study or more available?
Yeah, it's on our CP healthcare transition website. So it's one of the resources linked there.
Ah, fantastic. Okay, so we'll make sure we link that on our website so people can find that as a resource, which would be fantastic. We'd love to do that. Anything else that you can think of that comes to mind that can help with that transition process now? Because I love that first one, like just linking with someone who's been through it and having that, it's almost like a pure mentorship, isn't it? For health. Yeah.
Yeah. I think what's came up from, again, aside from the transition process, which I might touch on in a second, but that idea of growing up with CP and just, learning to advocate for yourself, communicate with health professionals, it's something you don't learn overnight, and just giving the young person obviously space and time to learn those skills rather than throwing them in the deep end when they're 18 and saying, go talk to the GP yourself now. And some young people I know in our research talked about how beneficial that was to have a bit of extra time and encouragement to talk directly to health professionals. But at the same time, sometimes they felt like they were being told to, I suppose, go find out this information yourself, try to learn how to self-manage things, but not having that person to go back to. So if they got lost, there was no mechanism to kind of catch them.
Right.
And so there was a bit of a conflict, I suppose, in what some health professionals thought. They were trying to instill self-management skills, and young people felt that they would just been left on their own to figure it out without having a support network. So getting that balance where definitely we need to teach self-management skills around a whole range of topics, but at the same time ensuring that young people know there is a place that when it doesn't work out, they can come back and I suppose get some information and get support.
Yeah. I mean, that's complex, isn't it? It's like, it's health literacy that they're having to learn about themselves. It's quite complex.
Completely. And I say all of this, and I think we know health professionals, whether it's a physio or OT, you have, you have a certain amount of time at young people, and you probably have a goal that you're focusing on. And this is an add-on to that.
Yeah.
And it's a layered approach. One conversation isn't going to help. It's multiple conversations. And so actually one of the big things I think with the transition process is having a coordinator or a transition coordinator as a person to support each young person through the journey. If definitely what we found from the research was that everybody was interested in it, but it was never a dedicated part of their role. So they never had dedicated time to support transition.
Sure.
If they don't have it, then it's someone else's responsibility and it falls through the cracks. Unless there's lots of brilliant clinicians who are trying to make it happen and spending lots of time on it. But I suppose if there's no continuity or sustainability in that. So one, I suppose, key recommendations is to create a transition coordinator.
That is so fantastic. And I think you're so right about that, because you're right. Everyone is interested in it. Everyone knows it's important, but it's not a dedicated part to your role. So it's always like, make sure you bring this up. Make sure you speak to someone about this. But who is that someone? I think I can totally relate to that. And, I heard once from a really knowledgeable mum who was really trying to empower her daughter to be able to take this process on. And she had her going to appointments where she was the one having to talk to the doctor about what botulinum toxin felt for her. And then from that information, it was really empowering for her to then be able to self-advocate. But if you don't give those opportunities with people that you've known for quite a while, really, it's going to be quite hard to start that out with someone completely new when you're trying to tell them about your body and your health. So that sounds like what you were talking about before.
Yeah. Yes, completely. And as some young people put it, you have, 17 years of your life, basically from the moment you're born to now, where you have all of this health and medical information that often your parents know and you don't know the detail of it, and all of a sudden you're expected to summarize it in a 10-minute appointment.
That's right.
It's challenging for anyone, let alone a young person. It's
Absolutely.
Trying to figure things out.
What about, this is a really tricky question. I'm not expecting, we've got the solution to it, but again, chronic health conditions, we think it's impacting more GMS level 3, 4 and 5. And for many of our young people who are classified within level 4 and 5, may also have difficulties with how they can communicate, or they might need to use an AAC, which might take a little bit longer for them to communicate this with their doctors. Have you had any experience with that process from transition from young people as well, from parents as well?
It's definitely in the adult healthcare system. So when we looked at experiences of health services amongst adult CP, that came up as one of the main themes. So I suppose communication in general was challenging, but particularly for people who use AAC and in hospital settings where people don't understand the how to communicate with people and how to use those AAC effectively. But I think something else that came up is that health professionals maybe assumed that you couldn't support certain groups of people with CP to self-manage or to take control of some aspects of your health. And I think there is always, we shouldn't be talking about independence because nobody is completely independent. We all rely on our support networks, and it's about shifting that balance of power slightly so that we're allowing a young person to do as much as they can and make their own decisions as much as they can, but with that support network behind them. And I think that's the shift. I know it is challenging though, but I think there's lots of skilled health professionals who have shown how it can be done.
It's so true. I think we do use that wording probably to the detriment, I think, by saying we're aiming for independence. But that's not the goal here. It's, of course, if you are classified within levels 4 and 5 and you need more support with your communication, you're going to need to make sure that's all set up as well. Just a point with regards to that, if a pediatric therapist with that pediatric skill set gets involved, at what point, how far can they continue to support someone as they become an adult? Do you think they can continue to do that? Are there more specialized skills they need to learn before they embark on that? What ideally could that look like, or should that look like?
Yeah. I've heard different perspectives on this from that pediatric, I'll say physio. They could apply to any health professional. The pediatric physios feel like they shouldn't see adults with CP, that they don't have the skill sets. And then in other situations, I know pediatric physios have just kept their clients on the whole way if they work in a private setting, and then they just adapt those skills. So it definitely is possible. I think we should be encouraging pediatric professionals, both health and social care professionals and doctors, to move into working with adults, because that's where the gap, and there's no adult professionals really taking up the, being the one to stand up and say, I'll take on this group of service users. And I think there's great examples of where it's worked. Yes.
That's exciting though. That's a very lifespan approach, isn't it? And I think that's really important. So I guess from here, I'm sure your team are doing lots of work. Where to from here for you and your team?
We're going to continue trying to share all this knowledge about adults with CP and advocate for better services. And I think that comes down to partnerships with different organisations. We're trying hard to get that information out there to justify why we need services. Some other projects that we're working on at the moment, we're looking at the mental health of young people with CP, not because it was our specialist area at all, but because it came up as a need. People told us, please do the research on this. So after we looked at the difficulties they faced in relation to mental health, we now have a grant to try to develop supports to address some of those challenges. So we're working on that over the next few years. And we're also working on developing some resources for GPs to better take that knowledge of adults with CP and support them to support adults
Absolutely fantastic. Look, you're doing very well, Jennifer. I know that your kids are now looking for you. You're doing very well. I just want to say you're doing very, very well. Thank you so much for summarising that. I've taken you away from your kids this morning for about nearly an hour. So grateful for your time and so grateful for you to have run through this. I really want to encourage everyone to look at this website, cphealthcaretransition.eu. We'll pop a link for that on our website as well at researchworks.academy. We've got all of our listings there. You can find all of the episodes really easily. And this is going to be such a great resource for everyone. And I feel like, Jen, that was a bit of a call to action because I think we've always called ourselves, I certainly have called myself a pediatric physio for so long. And increasingly, I'm dropping the pediatric part and I'm just saying, I'm a physio. And I feel like even that's like the childhood onset disability. This is the transition point, I think, just to kind of go, I think I'm dropping the pediatric part. I don't know. I think that's where we're headed, right?
Yeah. Definitely. And I think it's, we need a lifespan approach. There's people who know CP can support, you have knowledge throughout the life to take that long-term view.
It is so
true. I wish more people would start considering that.
Yeah, we spent our whole careers understanding CP, right? And who else is doing that? Yeah. And it's the pediatric physios, inverted commas, that have spent their time, OTs, speeches, we really have done that. So it's a really important point, and I'm sure a lot of people will be thinking about that moving forward. So thank you once again for being on the podcast, Jen. It was just such a pleasure to speak with you.
Great. Thanks very much for having me.
Lovely to have you. To all of our listeners, make sure you head over to our website, researchworks.academy, for all of those links. Thank you for listening, and we'll talk to you all again next time. Bye, everyone.